So Nick, you and I work together, and we're both POCUS enthusiasts. Just for the camera, this is Nicolas Lim. He's one of our final year emergency medicine SBR trainees in Ireland, and he's very much a thinker and a doer in the field of point of care ultrasound. You had a talk today about three kind of high yield applications in POCUS. Can you take us through kind of three high yield points from that talk?
Yep, sure. So I talked about the AAA scanning. So I've advocated that trainees start lower. So we start from the umbilicus or start from the bifurcation and then move your way up. Then the other one was my personal favorite, which is lung ultrasound in acute decompensated heart failure. And the take-home point is that if you see B lines bilaterally in two or more zones of the lung, it's acute decompensated heart failure until proven otherwise. The last one is about pain control, regional anesthetic procedures in the emergency department for thoracic injuries. So I talked a little bit about the ESP, erector spinae plane block, and I would say that it's actually a much more simple, easy to teach technique to treat pain control in quite a common condition in a lot of patients.
And Nick, what I found very interesting, and I suspect you did know what you were doing, obviously, but in terms of you blended some of the material. You've obviously seen Ross's techniques, Ross's P-cube techniques, and you had a little jar on the seat. And every time you came close to using any sort of language that was unparliamentary, you spent a few pounds. Or what did you do?
Yeah, I think the total damage was about €6 or €7. But I unfortunately I did use some unparliamentary language, but I think it adds to the story. So the P1, P2, P3, because I think a lot of physicians, emergency physicians, if they see a AAA, an unparliamentary language is usually what goes through their mind initially. So yeah, that's.
So what you did was it was a STAR technique, so there's something they'll always remember. So, and I think people will. I think people will remember the conversation you had with them, the stories you told, and the learning points that they took home from it. So thank you.
Thank you very much.